Okay, so we're going to start with resting scapular posture. We're going to talk about what we're looking for with regard to normal on John here. So first thing we're going to do is we're going to identify midline. So here's thoracic spine, and we're going to identify our two scapula. Usually it's easiest to find the inferior angle first, and then to palpate the medial border. So first what we're looking for is the resting position regarding protraction and retraction. We're looking for symmetry, and we're looking for about 5 centimeters of protraction from midline, which would be about 4 finger widths. So if we take midline, we're looking to see if we sat our hands here, do they contact the medial border, and do they rest in the same distance from the thoracic spine on either side? So for John, here's his medial border, and he does. So we would say that's pretty much within normal, about 4 finger widths from midline. Okay, so then next we're gonna look at height of the scapula. So is the scapula elevated, depressed, one side versus the other? For this, what we're gonna do is we're gonna take a look at the superior angle and the inferior angle. The superior angle should rest roughly at the second spinous process in the thoracic spine, so T2. So if we count down from the neck, we're at roughly T1 here and T2 here. Spine of the scapula, yep, so he's pretty level there. Inferior angle should rest somewhere around T7 or T8. So if we continue to count down, here is his T7, here is his inferior angle. And so on both sides, he rests symmetrically at T7 for his inferior angle. So we would say that that's normal. One side isn't excessively elevated or depressed compared to the other side. Next thing we're gonna look at is rotation. So the scapula should sit in approximately 10 degrees of upward rotation. Our reference points for that, again, will be the superior angle and medial border versus the inferior angle. If a scapula is sitting in upward rotation at rest, the inferior angle should sit more laterally than the superior angle. They shouldn't sit in line with each other. So on John, on his right side, here is his inferior angle. Here's his superior angle. So you can see that his inferior angle sits slightly lateral to his superior angle. So we would say that this is approximately normal upward rotation of the scapula at rest. John, I'm gonna have you face the side next for this one. So we're gonna look at anterior and posterior tilt. The scapula should sit in some anterior tilt normally because it's following the curvature of the rib cage. So what you can do is you can place your hand on the scapula. Specifically, you're going to push the palm of your hand towards the inferior angle and rest your fingers up towards the supraspinous fossa. You should see that it sits in slight anterior tilt based on that orientation. Excessive anterior tilt would result in a very prominent inferior angle. Okay? And so then the other thing you can do, and John, we're going to go ahead and have you face the wall again, is you can look at internal and external rotation. So it's normal, again, for the scapula to sit in some internal rotation because it's resting against the rib cage. So what you can do is you can put your hand here. So the heel of your hand goes on the medial border of the scapula, and your fingers come laterally towards the clenohumeral joint. What you should see is that it sits in slight internal rotation. Excessive internal rotation could mean that you have more of a prominent medial border of the scapula.